Hey guys, hello and welcome to my YouTube channel. In this video, we are going to talk about the chronic pancreatitis. My name is Speedy Medical. I have passed the Usmle Step 1 examination in my first attempt, and in these videos, I am talking about the different topics and how they are asked in case of the Usmle Step 1 exam. So the chronic pancreatitis is not that important as the acute pancreatitis. So this video will be a short video, not that long as it was with the acute pancreatitis. Now, what happens in case of chronic pancreatitis is that there occur the repeated attacks of acute pancreatitis. Now, there will occur the repeated attacks of acute pancreatitis, and you just think that in each attack of acute pancreatitis, some amount of pancreatic tissue is damaged. Okay, now when the repair occur, the viability of the tissue may be lost, or since the tissue is not having the regenerative capacity, therefore with each attack of the acute pancreatitis, some amount of tissue is lost. And ultimately, when there occur cycle after cycle repeated attacks of the acute pancreatitis, there occur loss of parenchyma, of the pancreas, and as a result of the repair process, there will occur the fibrosis within the pancreas. Now, there will occur the fibrosis within the pancreas, and also because the tissue was being destroyed, there will occur the calcium deposition over there. In case of acute pancreatitis, I told you how the calcium deposition occurs in case of acute pancreatitis. So similarly, in case of chronic pancreatitis, there will be calcium deposition in the pancreatic parenchyma. And also there is a very specific feature which is seen radiologically, that there will occur the ductal dilatation. So let's say this was a normal duct, and now in this area fibrosis has occurred. So naturally this part will dilate, so there will be something which is called as ductal dilatation. But the important thing is that you must recognize that there is loss of normal parenchyma of the pancreas, and since there is loss of normal parenchyma of the pancreas, the normal pancreatic function, which is related to digestion of fat and related to the release of insulin and glucagon, okay, so that normal function of the pancreas will be lost. So there will be no fat digestion, and there will be no insulin and glucagon release when the chronic pancreatitis has occurred to a huge extent. Now, we must remember, or we must know, what are the causes of chronic pancreatitis. Now, as I already told you that chronic pancreatitis is nothing but it just occur because of the repeated attacks. So we must know what causes chronic pancreatitis. So in order to know what causes chronic pancreatitis, we must know what are the triggers of repetitive attacks of the acute pancreatitis. So in case of elderly or in case of adults, obviously it is the alcohol. Okay, so it is the alcohol which is causing the repetitive attacks or the repeated attacks of acute pancreatitis, thus causing the chronic pancreatitis. While in case of children, or I will say infants, there is a condition which is called as cystic fibrosis. Now what happens in case of cystic fibrosis is that these pancreatic ducts, they will get blocked with thick secretions, which will build up the pressure, and as a result of the buildup of the pressure behind, there will be acute pancreatitis, and these repetitive attacks of acute pancreatitis will cause chronic pancreatitis. So we must know what causes the chronic pancreatitis. In case of adults, it is the alcohol, and in case of children, it is the cystic fibrosis. Now, regarding the presentation of chronic pancreatitis, the chronic pancreatitis has a very vague presentation. You just remember that this has a very vague presentation, and in the exam scenario, the presentation will be vague. They will just say that there is an adult who gets abdominal pain with meals, especially the fatty meals. Now, when there is a patient who is getting the abdominal pain with the meals, there are two differential. One is the peptic ulcer disease. Obviously, that gastric ulcer, it has pain associated with meals, and the second differential must be chronic pancreatitis. pathways. Okay, although with acute biliary colic also presents as a pain right after the meal, but that pain is localized to right upper quadrant, but in this case it will be epigastric pain. So must remember that an adult having abdominal pain, especially after meals, a very vague pain, is a candidate for chronic pancreatitis. Now secondly, as I already discussed, that there is loss of normal pancreatic parenchyma, so obviously there will be fat malabsorption. And what is that thing called as? Whenever there is a condition of fat malabsorption, we call it as steatorrhea, because there will be loss of fat in the stools, and this phenomena is called as steatorrhea. Now along with the fat malabsorption, there will be malabsorption of the fat soluble vitamins. So let's say that there are fat soluble vitamins like A, D, E and K. There will be malabsorption of those vitamins as well. And when there will be loss of whole pancreatic parenchyma, let's say that after some time the whole pancreatic parenchyma is lost, so there will be loss of islets as well. So as a result of the loss of the islets of Langerhans, there will be something which is called as diabetes mellitus. So these are the main clinical features of the chronic pancreatitis. Now there are two things which have to be remembered, and which play a very important role in the diagnosis of chronic pancreatitis, and often they are just given in the exam stems, like they will be given in the exam stems, like this patient is having this thing on the CT, and what is the diagnosis. So when we do the CT in case of chronic pancreatitis, there will be two findings. One is what is called as the calcifications. So you will see the calcifications in the whole pancreatic parenchyma, and secondly there will be ductal dilatation. Okay, so I already told you how does the ducts they undergo dilatation. So the ductal dilatation will look something like this, and this is called as chain, because it is a chain of lakes, because these dilated duct, they just look like lakes. So this is called as chain of lake appearance, and it will be seen on the CT. So on the CT we will have calcification, and we will have ductal dilatation, and we will have the chain of lake appearance. So this is the whole scenario of chronic pancreatitis. And regarding the treatment, it is just the replacement of pancreatic enzyme. So this is the whole thing that you should need about the chronic pancreatitis in order to answer most of the questions related to it in the USMLE step 1 examination. So thank you so much for watching this video. I hope that you like this video. For more videos like this, do subscribe to our YouTube channel.